Hi Chris, so today I'm going to talk about poop, abnormal poop, and butt stuff. So if you don't want to hear about that, well, there's a pause button right there. Oh, I'm also going to mention ulcers, bleeding, cancer, and butt sex. So, pause button. Okay. Number 2, I'm not a doctor and none of this is medical advice, except the parts where I say you should see your doctor, because that involves seeing someone who can actually give you medical advice. I am willing to recommend that you talk to your doctor most of the time. Now you may be wondering why I would want to talk about poop and butt stuff, but the phrasing of that question pretty much describes my reasons. Poop is seriously taboo, so much so that studies involving feces are less likely to get funded, and that is a problem because 1, there's loads of important fecal science to be done, and 2, butt stuff really matters. Colorectal cancer alone accounts for 1% of all deaths worldwide. That doesn't sound like a whole lot, but it is a whole lot. That's more than war and all other violence combined. And how do you know if you have colorectal cancer? Well, the fact is that you probably don't, and that's why it's so important that you get screened regularly, especially if you're over 50 or engage in receptive anal intercourse. Now, for folks who reach a certain age, your doctor is very likely to suggest regular screenings to you, but for folks who engage in receptive anal intercourse, they might have to do a bit of self-advocacy in order to get the screenings that they need. What does a screening involve? Well, usually you take a laxative to clear out the digestive tract, and then they take a camera, run it into the anus and through the colon just to look. This is a magical time to be alive. Turning away somewhat from colorectal cancer, I'd like to talk about a major indicator for bowel trouble: abnormal bowel movements. There are 3 things that characterize a good bowel movement: color, consistency, and comfort. We'll start with color. Now, bowel movements generally should be some kind of shade of brown, unless you've eaten something that changes the color. Beetroot and Kool-Aid have both caused a lot of unnecessary anxiety in this regard, so remember, if your bowel movements are abnormal color, think hard on things that might have dyed it that way. If your stool is streaked with red, or there's red when you wipe, that's probably blood, and you probably have hemorrhoids. Objects and body parts inserted into the anus and rectum can also sometimes cause tearing and bleeding, so prevent that with lots of lubricant, and talk to your doctor as soon as it happens. If you do not tell your doctor that you've been putting stuff in your butt, he's probably going to assume that it's hemorrhoids. Another aside, as a rule of thumb, if something is going into your butt, use protection and/or use things that are designed to go in your butt. So instead of experimenting with household objects, if you want to explore butt stuff, I really encourage you to go down to your local sex shop and just ask. You'll probably find them non-judgmental and interested in selling you sex toys. When shopping for sex toys, it's a good idea to look for something with a flange or a brim at the base, or a built-in piece of string so that the toy does not drift deeper than you'd like, because that is a doctor's visit that nobody wants to make. Returning to color, now if the stool has bits that look like strawberry or blackberry jam, those are probably blood clots, or if the stool is black, that can indicate bleeding in the digestive tract. That is a serious problem, and you should see your doctor as soon as possible. It can be caused by ulcers, or cancer, or infections, or a number of other things. See your doctor as soon as possible. Now, how do you tell if your stool is black or just dark brown? Well, you remember the nightmare goo that invades Slumberland and Little Nemo's Adventures Insane? If you don't, that's a great movie, I recommend it. Your stool from a GI bleed looks kind of like that nightmare goo. But either way, make an appointment with your doctor as soon as possible. Your doctor will definitely be able to tell. Now, stools in greens and yellows could indicate that there's bile in your stool, which might mean that it's passing through your digestive tract a little bit faster than normal. That's not a big problem unless it's happening consistently. So if it happens twice in a row, just talk to your doctor. Now, I don't have time to go into every other possible color of stool, but as a general guideline, if your stool's an abnormal color that I haven't mentioned yet, have a good think about what could have caused that color, if there's any sort of dyes you've eaten recently, that style of thing. And if you can't think of anything, then by all means, talk to your doctor. It's a good idea for you to feel comfortable talking to your doctor about the color of your bowel movements. It will make your life easier in future. Now moving on to the other 2 C's, consistency and comfort, and they do go hand in hand. Hard stool can be very painful and uncomfortable and difficult to pass. It often comes in pellets, chunks, or compressed balls, and it's the most common type of constipation, so go ahead and talk to your doctor about it. Some lifestyle recommendations he might make are eating more fiber, drinking more water, exercising regularly, going to the bathroom as soon as you feel the urge, and not spending any longer than necessary on the toilet. Now, he might also recommend some over-the-counter remedies like stool softeners, mineral oil, or laxatives. Please bear in mind that using any of those can be harmful if they're used long-term, and you should talk to your doctor before beginning any of those regimens. If your stool is soft, that's not a huge problem, but if it's loose or watery, remember to stay hydrated, and you want to talk to your doctor as soon as possible, as that could be an indicator of a number of problems. If in addition to being loose or watery, it is also bloody, or the diarrhea has gone on for more than a day, then go ahead and go to the urgent care or the emergency room. Worldwide, diarrheal disease kills more than war, all other violence, and colorectal cancer combined. Well, Krista, that's all the poo and butt stuff I had for you today. I really hope this video was educational, but more than that, I hope that I helped in some small way to break down the taboos about poo and butt stuff. I hope that this degradation spreads to other spheres where our inability to discuss matters frankly makes life worse for everyone. Krista, I will see you tomorrow. While I was shooting just now, I got some light out of the corner of my eye. I'm like, gosh, that street light's getting brighter. That is the sunrise. So I spent a lot of time researching this video. You're welcome.